Welcome back to America Right Now. I'm Tom Basili. We've got a whole lot more coming up in today's show, but let's first check in with Amanda Brilhanti for the other headlines that we're following today.
Tom, here's what we're watching right now. School districts around the country are starting to re-implement their in-school mask mandates amid rising COVID-19 cases. The school district of Philadelphia and the Berkeley Unified School District will now require the mask indoor to lower transmission rates. And this comes as Philadelphia County has seen a 59% increase in daily COVID-19 cases in the past 2 weeks. Meanwhile, 8 people have been arrested and charged after a 15-year-old girl was allegedly trafficked from a Dallas Mavericks game at the American Airlines Center. The girl went to use the bathroom while attending the game and never returned, going missing for 10 days. Authorities located her at an extended stay America hotel in Oklahoma City. And the 147th Preakness Stakes is set to run today at the Pimlico Racecourse in Baltimore, Maryland. Kentucky Derby winner Rich Strike won't be there, meaning there'll be no winner of the horse racing's coveted Triple Crown this year. 9 horses will line up later today, and the Hall of Fame trainer Bob Stafford, well, he's still suspended from the races. Those are some of your headlines. For breaking news, go to Newsmax.com. Tom.
I just hate to see these mask mandates coming back. I think it's so ridiculous. You cannot stop a virus. You just can't. And just because cases are going up doesn't mean that they're severe cases or they're hospitalized. Anyway, don't get me started.
Well, the amount of outrage you see over mask wearing, it's surprising to see them go back on that. And as we know, Broadway extended their mask wearing for their shows. That's going to be until end of June, early July. We'll see what happens.
Well, they're both sort of liberal, very, very liberal, very deep blue areas that are starting to do it, unfortunately. Thanks so much, Amanda. It's been a week since the tragic mass shooting at Tops grocery store in Buffalo, New York, which claimed the lives of 10 innocent victims. The alleged shooter, 18-year-old Peyton Gendron, showed warning signs of mental illness for years. At one point last year, he was even sent to a psychiatric evaluation after threatening to shoot up his high school. For all the discussion over school and law enforcement officials missing warning signs, what about parents in these circumstances? Joining me now to discuss is board-certified clinical psychologist. He's America's psychologist, Dr. Jeffrey Gardere. Doctor, welcome back to the show.
Thanks for having me, Tom.
So this kid, from what we understand, beheaded a cat in his house. He wore a hazmat suit to school. We have pictures of that. And there was there's some evidence that he may have threatened to shoot up his school, but his parents didn't seem to be getting him the help that he needed. Do you find that a lot of times parents put blinders on when it comes to addressing mental illness?
Parents are human beings, and though it doesn't make it right, I've worked with many parents, Tom, whose children were in the middle of a mental health crisis. It was obvious that perhaps they were becoming psychotic, and some of the parents just could not deal with that. That is their darling child. They don't want to think of that child having severe mental health issues, and therefore the signs are there, but they are in denial as to what's going on. And that is really unfortunate, because we know if they do accept the reality of what's happening, they can get help and intervention for that particular child.
Doctor, what are some of the red flags, even subtle ones, that parents can look for to evaluate whether their child needs some form of professional intervention?
Well, listen, all people tend to have some issues with regard to some mental health challenges. But when we're dealing with a mental illness, this is something where perhaps they cannot go to school, or they're not able to focus on their schoolwork. A lot of the things that once brought them pleasure or hobbies they were involved in, all of a sudden they leave all of those things behind, and they become very, very quiet. They tend to become very introverted, and sometimes they become very rageful. But a sure sign is when they stop taking care of themselves and stop communicating with their very close friends.
If parents detect warning signs from their child, and again, I'm a parent. I totally understand. You don't want your child to be stigmatized. It's very difficult to come to that decision that you need some sort of professional intervention. But we know that mental illness is so prevalent in our society because of all the stimuli that these kids get and the pressure that's put on them. What would be the proper kind of next step, even if it's a baby step, for those parents to take just to make sure that they're not dealing with a much bigger problem?
Well, most importantly, they should go ahead and connect with the school. There are school nurses and guidance counselors and social workers, especially after COVID, that have been assigned to many of these schools. Have the conversation. Look at possible testing, a mental health evaluation for your child. Check with the family provider and see whether there is something, some sort of conversation that can be had where that child can, in fact, talk about some of the things that may be going on. But you're right, Tom. It is taking that baby step, that very first step. And every step that you begin to take makes it easier for you to realize that your child may have an issue. But again, as I said earlier, Tom, early intervention, getting to the problem as quickly as possible will help not only perhaps mitigate it, but will help that child with future issues that may be happening.
Real quick, Doctor, we've seen this happen before. Parents don't take action and a tragedy of enormous proportions unfolds because of that. How do we change that dynamic in today's society?
Well, I think it's important that we need to be responsible, not just to our children and to our families, but we have to be responsible to society. One of the worst things that a parent can go through, of course, is seeing that their child taking someone else's life, not just their child losing their life, out many other lives, a life of another person, an innocent bystander. And that's something that I don't think anyone wants to live with or live with that responsibility. So you've got to do the right thing and get that intervention for your child, because that will determine how well they will do in life later on. These things can be helped, and there are treatments that are out there to give your child a very normal life.
All right, America's psychologist, Dr. Jeffrey Gardere. Thank you so much, sir. Appreciate you.
Thank you.
Hey, I'm Rob Finnerty. Thanks for watching. If you enjoyed this video, please join the conversation in the comments below. Don't forget to subscribe, too. Hit the bell icon to be alerted to breaking news. And remember, there's a whole lot more on Newsmax TV, America's fastest growing cable news network. Newsmax TV, we're real news for real people.